Hi guys, welcome back to my channel. So in today's video I'll be sharing with you 5 top tips to help you get pregnant if you're trying to conceive. I'll be sharing with you some of the things that I did and that helped us conceive, and some of the things we learned along when we're trying to conceive. If these are some of the things you're interested in, why don't you keep on watching this video. Tip number 1 is to start taking folic acid. It is recommended that you start taking 400 micrograms of folic acid every single day until week 12 of your pregnancy. Ideally 3 months before pregnancy and throughout week 12 of your pregnancy. Don't worry if you find out that you are pregnant and you haven't started taking folic acid. You can just start as soon as you find out that you are pregnant. So it is important to take folic acid because folic acid helps prevent neural birth defects such as spina bifida. If you are someone who has certain health conditions such as diabetes, or even if you have neural birth defect yourself or your partner has neural birth defects, then it is recommended to take at least 5 milligrams of folic acid. Again, if you're someone that takes anti-epileptic medicine or antiretroviral medicines, then you would need 5 milligrams of folic acid. Folic acid 5 milligrams cannot be bought over the counter, cannot be bought in pharmacies. However, you can get prescription from your doctor or your midwife. So it's important to speak to your doctor or midwife if you have these kind of conditions or if you're taking these medication. You can get 400 micrograms of folic acid from your local pharmacy. You can also get folate from the food that you eat. However, the amount in the food is not enough to keep a healthy pregnancy. Tip number 2 is to understand your cycle and know when you are ovulating. Without understanding your cycle, you will never know your ovulation days. Most women believe that ovulation days falls between day 13 and 14 of their cycle. However, this applies to the average 28 days cycle, and this can vary between women to women, and of course between cycles. Cycles can be from 21 days to up to 35 days. So if you're someone with a 21-day cycle, you're less likely to ovulate on day 14 or day 13. Just the same way, if you're someone with 35 days cycle, you're less likely to ovulate day 13 and 14 of your cycle. So it's important to know when you are ovulating. This gives you a better chance of conceiving. Ovulation days or ovulation windows can be calculated using the calendar method. It can also be calculated by using your body temperature. However, if you're someone that struggles to know these, then you can get some ovulation kits. So tip number 3 is to get your partner involved. It's both of you that's trying to conceive. The load is not only on yourself, but it's on him as well. So you can talk about taking prenatal vitamins together. There are prenatal vitamins that are specifically for men, so he can also try taking these supplements. These supplements will help them to have a healthy waist and of course to have a healthy sperm, because we need a healthy sperm to conceive, right? So this is the reason why you need to have this conversation. If they have certain habits that also put them at risk of not having a healthy sperm, then you can have the conversation of either stopping or quitting. So some of these habits can be, one, if he is a smoker or someone that drinks over the limit, so they don't drink within the limits, then they can limit the amount of alcohol they take, and of course quit smoking. These things put them at risk of not having a healthy sperm. So have this conversation with your partner and of course come up with a solution that will help both of you. Tip number 4 is to stay fit and maintain a healthy weight. If you're someone that is overweight, so someone that has a BMI over 30, then this is generally classified as being overweight. This means you are not on a healthy weight. Therefore, it's important to try and lose weight in order to give yourself a better chance of conceiving. So tip number 5 is to look after yourself. Look after your mental health and your well-being. This is so important. Sometimes it is underrated, overlooked. It's overlooked, but it's so important not to put pressure on yourself or your partner, as this can affect your relationship. I know trying to conceive can be stressful. It can give you anxiety. If you feel like you are struggling or both of you are struggling, then it's important to seek help. it's important to speak to your GP, your doctor, because we want to create a health environment for the baby to develop well, for you to be able to carry the baby to full term. All right, guys, I will end this here. Don't forget to subscribe to my channel, and I shall see you all in my next video. Take care. Bye.